It's National Osteoporosis Awareness Month, and while 50% of all women over the age of 50 suffer from this condition in some form, a good percentage of men in that same age bracket are also at risk. Dr. Desmond Ebanks, the medical director of Alternity Healthcare, joins us now to explain. Doctor, thanks for joining me.
Thanks for having me, Yvonne.
So let's just start off. What is osteoporosis?
Well, osteoporosis is a disease characterized by low bone density and increasing destruction of the bone, resulting in very fragile bone and increasing your risk of suffering a fracture.
And unfortunately, men seem to think sometimes that it's just a woman's condition, but you're saying no, no, no.
That's true. Most people think that, but in the United States, there are about 2 million men affected with osteoporosis right now, and another 12 million at risk with low bone density.
Let's talk about some of the warning signs that we should all be aware of.
Well, with osteoporosis, that's part of the problem. There are no symptoms. So that screening is key. Unfortunately, for many people and many men, they don't realize they have osteoporosis until they suffer a fracture, because there's no organized screening procedure for men as there are for women, at least until men reach age 70. And right now, 1/3 of all men over age 50 in the United States will suffer a fracture due to osteoporosis in their lifetime.
So what do you suggest? Do you suggest that once you hit 51 or so that you just go in just to get a screening? And when they go into your office, what do you do? What kind of testing?
Well, the screening for osteoporosis is a DEXA scan or bone densitometry scan. And we do that, and we advocate that in our practice. Again, it's not standard. Many insurers will not pay for that for a man, which is a little strange because osteoporosis is a preventable disease. Now, in my practice, when we've screened men over age 45, 63% of them had low bone density and 12% had osteoporosis.
So you're saying 45 is even a good age to go in?
45 to 50 is the time when men should start screening.
As far as a procedure, when you go in, is it fairly quick? I'm thinking if it's just a scan, it's painless.
It is painless, okay. And it's relatively quick. A bone density scan takes about 10 minutes, or so 10 or 12 minutes, and that tells us about the state of the bones. And there's some other blood tests you can do to see how your bones are being metabolized, because there's a constant renewal and wearing away of bone throughout our lives.
I'm curious, when these people come in to get screened and they find out they have low bone density, what's their reaction?
They're very, very surprised. And give you an example of one patient recently. He was 58-year-old, very avid bicyclist and swimmer, thought he was in very, very good shape, but noticed some deterioration in his performance is the reason he really came in to see us. And when we scanned him, he had fairly significant osteoporosis, and it was due to low testosterone, which is another problem that men over 50 suffer from that is not as well recognized as it should be.
So what can you do to offset the risks? Because you're saying this man exercised often. So what do you do?
Correct. And now some of his exercise wasn't the right type, but you have to be sure that in your diet you're getting the right vitamins. Vitamin D, vitamin K, vitamin C, and the B vitamins are very important. You have to do resistance exercises and weight-bearing exercises. You need to eat calcium-rich foods, and you need to get screened.
Okay, they're fairly simple things that you can do to prevent this.
Yes.
All right, thank you so much. I really appreciate it, Ebanks.
Right. Thank you again.
Thanks for your time.
You're welcome.